everyone, I'm Dr. Victoria Mutiso, and today I'm going to be giving you a brief introduction to the process of developing and testing mental health intervention by applying the Medical Research Council's framework for complex interventions. In very simple terms, an intervention could be a treatment or program that we implement and hope that we will achieve a specific outcome. It could be an individual medication or cognitive behavioral therapy to treat depression. For example, an outcome is the result or consequence of delivering the intervention. Sticking with the depression example, if your intervention is cognitive behavioral therapy, the outcome could be reduced symptoms of depression or increased functioning. Basically, an intervention is the action you take, and the outcome is what happened because of that action. We also know that it's not always as simple as just giving an individual an intervention and seeing if it resulted in the outcome of interest. There's so many moving parts which really makes an intervention quite complex. What do I mean by complex? Well, let's take CBT again for the treatment of depression. First, the intervention itself has many interacting components, such as changing cognitions and behavioral activation. Second, for the intervention to actually work, we need the client to be aware of the problem, be motivated to attend sessions and actively engage in the take-home activities. We also need the provider to be competent in the delivery of the intervention. Third, looking at context, there are many moving parts impacting on the delivery and effectiveness of the intervention. Examples could include the literacy of the client, the language used during the sessions, and even the stigma associated with the specific mental health condition. There is also the client-provider interaction. Further, there may be a number of groups or organizations involved in the intervention delivery. It's also important that interventions need to be tailored and delivered flexibly for different contexts. So we need to be constantly reviewing and adapting our approach. And finally, there are often several outcomes when we were exploring the effectiveness of interventions, not just one. It could be symptoms, functioning, or even activity levels, depending on the type of intervention. The Medical Research Council in the UK has developed and adapted a framework for complex interventions over the years. These frameworks provide guidance on designing, evaluating, and implementing complex interventions in healthcare and community settings. The framework isn't specifically designed for mental health, but rather any public health intervention. In 2000, the MRC released its initial framework for complex interventions. It emphasized the importance of developing and evaluating interventions in a systematic way. It introduced the concept of complex interventions itself, which we know includes multiple interacting components, and stressed the need for clear theoretical underpinnings and rigorous evaluation. In 2008, the MRC revised its framework to provide more detailed guidance on the development and evaluation of complex interventions. In 2021, the MRC and the NIHR, the National Institute for Health Research, further refined this framework, and I'll be discussing this framework in much more detail shortly. Before I describe the MRC framework, it is important to note that it is adapted from the stages of developing and evaluating drug trials. You may see some similarities as I describe the MRC framework. Let's now dig into the phases of the first MRC framework. The preclinical phase primarily concentrated on theory and the rationale behind why the intervention would be effective. Phase 1 focused on the modeling and answering the question how an intervention would work. In Phase 2, the focus was on exploratory trials asking the question, does it have potential and is it feasible? In Phase 3, we're moving on to a definitive randomized control trial asking the question, does the intervention work? And in Phase 4, at the highest end, we're asking the question, is it transferable, and looking at long-term implementation. Although this framework was valuable, there was a number of critiques. It was believed to be too linear and was modeled too closely on drug trials. It was also suggested that it needed more guidance on the development of an intervention and implementation. There was a very strong focus on randomized controlled trials, and we know that there are other ways to look at outcomes. There was also a lack of attention to very complex interventions. And most importantly, it didn't have too much information or attention on the actual context where the interventions were being delivered. In 2008, the MRC revised its framework to provide more detailed guidance on the development and evaluation of complex interventions. As you can see here on the left, development of the intervention was a key feature. In addition to identifying the evidence base, so a focus on using systematic reviews to first identify the current evidence was recommended. It also included an exploration of the theory behind the identified intervention, the process, and outcomes. How do we think the intervention works? What is the mechanism? Once an intervention is identified, a move to feasibility and pilot testing is recommended. Here we are focused more on the acceptability and feasibility of delivering an intervention rather than its effectiveness. We then move on to evaluation. At this stage, we focus on assessing the effectiveness, understanding of the change process, and also looking at cost effectiveness if possible. There are different study designs that are recommended for each of these. And this would be where randomized control trials would fit in. Once we know that an intervention is indeed effective, we then move to implementation. In 2021, the MRC and the NIHR published a new framework. You will see the first change on the left here. When identifying an intervention, the options are either developing a new intervention or identifying and adapting an existing intervention for a new context. The rest of the phases will look familiar from the previous framework. We have feasibility, evaluation, and implementation. You will also note that the other major change is the addition of the core elements in the middle. Essentially, the framework suggests that each phase, 6 core elements need to be considered to answer the following questions. How does the intervention interact with its context? What is the underpinning program theory? And how can diverse stakeholder perspectives be included in the research? What are the key uncertainties? How can the intervention be refined as more information is gathered? Finally, are there any economic considerations that should be addressed? I hope you enjoyed this introduction to the process of adopting and testing interventions using the MRC NIHR framework.